Good afternoon to all. I was introduced to Ayurveda by Dr. Krishnamurthy. He was the managing director of Ayurveda Wellness Conclave. So when I joined the Gurukula system of studies in Coimbatore, there was one research going on. I should remember that. That's why I am telling you. WHO research was conducted there in rheumatoid arthritis. And that result also came, and it was very much utilized for the future researches. So when we are thinking of research, we can have which is related to wellness. We can have 4 areas. One is the fundamentals, or literally, what are the basics of wellness we can have a research. This question of wellness was asked from time immemorial. There's a story in Kerala that one Ashtavaidya was walking and they came as disguise of parents and asked, how can we have health? Then this Vaidya replied, there are 3 factors for wellness. That is, one is good food, optimum exercises, and optimum sleep. These are the 3 pillars by which the wellness stands. So, what are these 3 areas? How we can live? This is very important. When I was taking classes for the Duisburg University in Hessen, I was the coordinator for foreign studies. At that time, they were asking one more question. That's very important when we think of it. There are medicines in India, but we don't have. We are not getting these medicines in Europe. So how can we solve the problem? So Acharya Charaka has told about it. He told that whenever disease comes, there will be medicines in that place itself. You have to search and find out the characters of that drug and you can utilize it. So I told them also this, and they brought some of the medicines. They are using it in Europe, in Germany, and we tried to find out what are the rasa, guna, vibhaga, and how can it be utilized in wellness and also illness. But it was not complete. Some of the drugs we can identify. And even one more, I should tell one more example. Dr. Lakshmi, she is a biochemist in US. She was telling Sahadevi, that's a Sahadevi, that medicine is available in India. And she was telling better variety is available in US, and she compared the 2 things and found out that this is more. What she got from the US was more utilized, more effective. So, when we think about the global area, how this Ayurveda can be spread, it can be in the theoretical methods of wellness, or we can have these 3 things, epitome, or the 3 areas like food, exercise, and sleep. These areas we should ponder upon. Then medicines also, as a and there are areas of drugs, plants, research also available. So we can have a very good, effective treatment even in the rural areas. And also, these principles of Ayurveda, which is always entered and you can utilize it in rural areas.
Hello. Yeah. So this was sir was telling about research in rheumatoid arthritis. I think Dr. Ramanohar. Hello. Dr. Ramanohar was working in this field for the past many years. This is very much relevant in the present scenario because about the science what we are doing in our research field and what best we can do. In that perspective, Dr. Ramanohar can give insight about the research work that is going on. Yes.
Yes, this was actually the vision of Shikumarji, where we studied in Coimbatore. Even when we were students, actually a WHO-sponsored trial happened in Coimbatore, where the unique thing was that normally when we test Ayurvedic treatments, we pick up one medicine or one formulation and test it like a drug. So Shikumarji's initiative was one of its first of its kind attempts to study Ayurveda as a whole system, which means personalization. We may not give the same treatment to all the patients. Each patient will get a separate treatment. So in traditional randomized controlled trials, this cannot be accommodated. We will be forced to give the same treatment to all the patients. So the WHO study led the foundation for a much larger and more rigorous trial, which I was involved in when I was working at AVP, NIH funded trial from the US, where for the first time we were able to demonstrate that, because up to that time many Ayurvedic medicines were studied for rheumatoid arthritis, but they were all one single, maybe Yogaraj Guru or Guruji, for example, Dr. Ramesh was mentioning about that. But they gave only modest results. So if you look at ACR criteria, American College of Rheumatology criteria of improvement, they classified into 20, 50, 70, now they are also coming to 90 because no drug X. So normally we find that if you use only single Ayurvedic medicines, we get only about 20% efficacy, 20% improvement. But our trial showed for the first time that if you give individualized treatment, multiple treatments to the patient, the outcomes are 70% improvement. We are seeing 70% improvement with whole system Ayurveda, which is comparable to Mito drugs. That was our study. It got an award from European Society of Integrative Medicine. It was published in the highest impact journal in the field of rheumatology and all that. So it is possible for us to do this kind of research. But I'd like to just come back before I conclude to what Ramesh was mentioning. Health is a continuum. We can definitely not, think of it as a binary. Health, illness, wellness. It is a continuum and there is a gradient and a leveling. But the point is, what is the claim we are making? So as a practitioner, what sir mentioned is very correct. You cannot say I will deal with only wellness or only with illness. But what is the claim we make? If we make the evidence has to be claim appropriate. Like if my claim is wellness related, if I say supports cardiovascular health, then I am making a wellness claim. The kind of evidence needed is very different. But if I make a claim it cures hypertension, then the evidence demand will be much higher. So it's a very tricky terrain. We have to use and make the claims very carefully. Our RA study was definitely an efficacy claim, which is a what is called as a health related medical claim. So we had to follow all the American College of Rheumatology criteria, which included what is called the disease activity score DAS-28, where a difference of 1.5 makes it clinically significant. So, but if we were looking at supports joint health, which is a wellness claim, then we wouldn't have had to go into this kind of.
Thank you. I think we have to go in a much more broader design from completely from wellness to disease management. Because that's how we can develop our total Ayurveda industry in a much better way. I think in that scenario, Dr. Ramesh is working even in say cancer, particular college. In many, because that is our area where all over the world people are looking for something different or something. So in that perspective, I think Ramesh
Actually, as far as cancer patients are concerned, I've had an opportunity to work with cancer patients for so many years. In one of them, I was working with modern Calcutta Medical College with modern medicine doctors, just to improve the quality, because it was a palliative care center, where the improvement in quality, we are only looking to improve the quality of life of those patients. And that was considerable, because at that time what I did was a very small study, because in that clinic 40% cases were with head and neck malignancy. So at that time, it was, I'm talking about 96, 97, at that time the Kozhikode or Senna, that was the laxative they were using, which was not at all effective in morphine-induced constipation. So morphine, because you know that morphine, when you give morphine, a lot of other aspects are also there, but one among them is constipation, because you may have to digitally evacuate the fecal matter, because it becomes like a rock. So you know that it is an unpleasant job for both doctors and patients. And we introduced Ayurvedic, it is published by Journal of Pain and Symptom Management in Elsevier Science series, you will get that. So with head and neck malignancy, if you administer 5 ml through the nasogastric tube as a prophylactic measure, the moment morphine is started, this is also started, and that considerably reduced the digital evacuation in that set. So that was one phenomenon. And now, Ayurveda, our institution is having a cancer center for last 20 years. There are 4 types of cases are coming. One is after conventional treatment, we want to prevent it. The second is they have done everything, but they don't have any relief with conventional treatment. Conventional treatment also told them, now we have nothing else to offer, so they don't know what to do. Third thing, after conventional treatment, they have side effects for that. And the fourth one comes for only for Ayurveda. So here itself, last 20 years data when we analyzed, we saw that many of them are living in a very good quality of life. And that is why we have applied for the Center of Excellence from the Department of Ayush, and that study is going. We are doing in a particular kind of lung cancer just to improve, because in 3rd stage cases are coming, so we may not be able to completely cure them, but improvement in their quality. There are so many people who are really doing very comfortably living. Because when you do the PET scan and all, we were talking about evidence based, that we are telling this example also. The person who is having even metastasis, after 3 months, 4 months medication what we give, when they go for PET scan, the metabolically active disease becomes minimally metabolic active in many cases. There are many cases it is metabolically inactive. So what I was trying to convey is that actually there are many things which can help. And actually speaking, Ayurveda and modern medicine are complementing each other according to my experience. And if they sit together, openly open up their mind and start doing things, it will be the benefits for the cancer patients. Thank you.
I would like to ask a question supposed to the from a traveler's perspective, what gives more trust, whether tradition or scientific tools? Can anyone from the audience? Hello. Still, you are bringing to what would like to get an answer from your perspective, from a traveler's perspective. What brings more trust, whether the tradition of Ayurveda or the scientific tools of Ayurveda? Can anyone answer?
Can you please answer the question?
Sir, this is Dr. Sikal from Frankfurt. The question for us is, as the gentleman first right hand side spoke, I would like to mention for your attention, I'm associated, or I was associated with Dr. Professor Krishna Kumar since 1981. And if we are looking at the perspective that we want to market Ayurveda as medical science, we need to have a different approach. Then it has to be a scientific approach. But if we are asking people to join us to live and spend time with Ayurveda, then it's a different approach. And it's important for us to understand, and let me give you a little bit brief history, probably it's well known to you. It all started somewhere early in the 80s, when Dr. Jayathalan was still in the Kerala tourism and Dr. Venu had just entered into Kerala tourism. Kerala was altogether a wellness destination. It was never an Ayurveda destination. It was a wellness destination. And now we started forcing it onto people and said, this is only Ayurveda. Ayurveda for me is an integral part of wellness. If we don't have Ayurveda, or the other way around, whenever you want to publish marketing. So it has to be correlated and interrelated to the product. What we are trying to market it to the West people. Living in the West, I do see that. We need to understand how the medical and healthcare system in these countries works. We need that out of our perspective. And that is why we are not so successful in marketing Ayurveda in the Western countries as a medical science.
That's not.
That's the same point I was trying to say. But the thing is, like, I was attending the second global WHO conference in December, and it was quite heartening to see another kind of discussion emerging there. On the one hand, we have been forced, like when we come into the area of medical treatments, we are forced to provide evidence that fits into the modern scientific framework. But there is also a new thought process emerging, and I was quite fascinated to hear new terms being used in the WHO even called epistemic justice. So, epistemic justice, there are a lot of Western scientists very strongly advocating for what they call as epistemic justice, which means that different medical systems don't have to completely conform to modern methods of validation and investigation. While there will be a point where there definitely will be overlaps, but traditional system shouldn't be asked to force fit, completely into the modern scientific paradigm. So they are even calling this as a two-eyed ceiling. Having one the traditional view and the other the modern scientific view, and then having a synthetic approach. So I was also involved with the WHO consultative group, where a few scientists from Carleton University are working to develop research methodologies that are suitable for traditional medicine. So that is also another important thing. So once that becomes acceptable, the whole paradigm will change. We will not be under pressure to completely conform to. I'm not saying we can completely eliminate that, but we'll have a more meaningful kind of framework to work with. I think that is the future.
Thank you very much for this explanation. But the question for me is, today the government of India and also the Ministry of Ayush is investing a huge amount of money to fund foreign institutions, foreign scientists, to prove the existence of Ayurveda as a medical science. Why it is so is, let me just finish it please. And why it is so? Because we are not being facilitated to give an international platform to put our results on the international platform. These people, those who are doing research on the international level at different universities, like you also quoted and Dr. Ramesh also quoted. But the question for me is, we need to give platform to our doctors, those who have done this research, and bring it to the international journals so that people accept Ayurveda finally has a proven scientific approach to the human being, which is a holistic approach.
I don't think Ayush is really doing what you can say imbalanced kind of support to foreign funding. Definitely not. In fact, even today, some of the most influential research work done on Ayurveda is by Professor M.S. Valieta. So his science initiative in Ayurveda came up with publications. There is no, you can see, now Ayush Ministry is trying to also engage foreign scientists, but nothing big has happened there. Nothing big has happened there. And definitely there is no extra focus on foreign funding. I mean, there is a lot of effort to strengthen ourselves from inside. And in fact, what I found is it's very difficult for Ministry of Ayush to do funds outside. There are a lot of restrictions. It's not at all easy.
I experienced that in practice, sir. I'm living in Germany. And I
There was
experienced that in
one
practice.
study that they have funded there, maybe for propagation and other things. Scientific studies it is very difficult. We are doing a rheumatoid arthritis study. There, a professor from US is involved. And because of his involvement, it took 10 years for us to get that up. And he cannot still be a clinical investigator in that trial. He is only a consultant.
On this, it is not easy to conduct this study outside because there are many reasons. Because the trend that we are using, nobody will not allow as because there are people monitors. It's not whatever may be there because we have our own experience in this about the research. Because we have found many events that is effective in many conditions and it is worked with a large and we have got result. But that itself we are going abroad, it is not easy to come out with that as a threat. So that is a different scenario.
One point I would like to, I feel one area where we have put priorities wrong is that we are trying to have international standard, premium and domestic. This looks kind of really imbalanced. We should give the best medicine to our people first. And if we do that, then we don't need to create a separate premium one to push Ayurveda outside. That is one thing which I strongly believe. So we should first give the best medicine to our own people. that we don't need actually.
I have a question to Dr. Ramanohar. You are associated with WHO and of course Ayush. See, many of our Ayurveda doctors who practice Ayurveda overseas, especially in Europe or in the Middle East, they are not allowed to take Ayurveda medicine. Now, today's panel discussion on research in Ayurveda and international acceptance. My question, when can we expect international acceptance for Ayurveda medicine overseas? For example, in China, Chinese traditional medicine is accepted worldwide and they get better acceptance than Ayurveda medicine. So, when can we expect Ayurveda that kind of acceptance overseas?
So that is a point I was coming to, is that we have to work for that domestic. We have to make Ayurveda standardized and of very good quality in our own country. That is the reason why we are not able to take it back. See, another thing is, one good thing has happened just a couple of days back in the EU. Our government has signed some pact, and now Europe has for the first time accepted our degrees. Now an Ayurveda physician can go to Europe and display the BAMS and MD degrees. And so now the practitioner has been accepted. And if we take necessary steps, it won't be long before the medicines also get accepted.
But to what extent? Because Ayush...
It will take time. It will take time. Our basic problem is that we are focusing on outside without first correcting what needs to be corrected here. What needs to be corrected in India. We have to make sure that there is no double standards.
And luckily, Dr. Naushad is practicing Ayurveda doctor in Russia. He might have a lot of problem to take Ayurveda medicine to Russia. So how can he take Ayurveda medicine freely without any legal barrier?
That is what I am telling. As long as we are not assuring quality here, there will always be the doubt what can be taken outside. If we can provide quality products for our own market, those same medicines will be accepted outside. Now the problem is, for our people here, we are not putting in the proper regulatory constraints.
So I just want to add to the EU India FTA. 2 degrees are not compatible in EU. It's medical and law. Just for your information. That will not be compatible. It's excluded in the FTA. I'm a professor, so I'm quoting that.
Okay, we'll discuss about that later. I think I have anything to add. I think this will cut short the.
Just one point, the demarcation between medicine and also food substances is very much illegal. So we can have some like food substances, etc. We are utilizing as medicines, and it is called as Mahabhaichan. So for wellness, we can have some of the things which can be taken as food itself, and for the wellness, you can utilize it in the Europe or the other countries.
So I think the time is running out. Is there yeah, he's raising. Yeah, please.
Thank you very much for the nice discussion, and it was very informative. I have a few questions. The one thing, you have discussed about the action of the mechanism of the drugs. So I believe that it is very important to get into the Western medicine. Action of the mechanism studies are, I think, a major one. But in Western medicine, most of the drugs contain only 1 or 2 or few active pharmaceutical ingredients. So when it comes to the 2 pharmaceutical ingredients, it is so difficult to study about the synergistic effects. But herbs are hundreds of, and the proprietary drones are thousands of chemicals there. So what are the strategies that we can use to study those kind of action of the mechanisms?
It's a very important question that you have asked. And this is what the problem we face when you go to standardization. When the synergic effect or antagonist effect of different ingredients of a plant actually confuses us which is the active ingredient which is working or which is the non-active ingredient which is. But actually, we learned a lesson because actually Dr. Suleiman, who was one of the senior scientists, should also be here. He will be, because he has done a lot of work on this area, and we always prefer not to go beyond a certain analysis. The drug as a whole, for example, I will tell you, in Sindaupa, in Parkinson's, when the active principle is taken and given, it has side effects. Whereas Atmagupta contains Sindaupa. If you give Atmagupta, that side effects are not very much prevalent. Here, what comes, the molecule as such is used in many conditions and the synergic effects actually helps. But it is very difficult to pinpoint it. We are actually working very hard to reach that end. That is what I can tell you about this. Thank you.
Thank you very much for that.
In that perspective, I do have an answer for that. Actually, I was involved in a work on the time of COVID. We have done an in silico study on the COVID, and we have come out with some 10 shortlist 10 of the drugs, which is having very good antiviral activity against SARS. And we identified that through the in silico study, and after that we have done in vitro study, we have found out that 3 of the drugs having 99.
I can hear metabolic fire is the most important thing. If we cannot absorb the essence into the body properly, the result is the toxicity. Toxicity, anything what we don't need, if we keep it, it's a disturbance. Just like you can see in Western countries, you have a garage sale. All the bad, broken stuff, people store in the garage. Then you sell. If the garage is full, the whole function is affected. Similarly, in the body, when the toxins are accumulated, it blocks the normal function of the body, leading to diseases, maybe the system-wise, organs-wise, or whatever. So in Ayurveda, we use the purification techniques to clean, or maybe like we have the clearance sale, main like supermarkets, they will have clearance sale, stock clearance sale, or like Black Friday, clearance sale. Just like that, the body needs certain type of shutdown, or people undergo fasting. The fasting and burning of unwanted toxins. In Yoga Shastra, instead of using all these kinds of medicines, but certain practices are performed to clean and purify and to enhance the digestive fire or the metabolism so that the body becomes pure. So we say the purity of the body is Agni, either in Ayurveda or Yoga.
Okay. So in Ayurveda we have daily routines. Dinacharya, we start our textbook start with Dinacharya, daily routines. How to, when to wake up, what to eat, when to sleep, all these things. Is there that kind of Dinacharya in yoga?
Yoga also, the Dinacharya is very, very important. So, the most important, best time is Ayurveda also, early morning. The best times Saraswati young, just after 3 o'clock, get up and eliminate this possible and thinking about etc. And then start cleansing, practicing yoga. The best time to practice of yoga is morning, no doubt. Totally intermittent.
Okay, so for an aspirant or for a beginner, what are the best ways to start yoga? How one can start yoga practice for a beginner?
Yoga, we can have several levels. The higher level to clean the mind, we use Abhyasa, Vairagya, Abhyam, Tandira. Abhyasa and Vairagya. And the medium level, Karma Yoga, Jnana Yoga, Bhakti Yoga, it is there. And the medium person, like ourselves, we have Ashtanga Yoga, 8-limbed yoga. In fact, it is a small journey from outside to inside. For example, Yama is the first one. Yama is Ahimsa, Satyam, he asked them all these 5 things. They are, don't harm others, Ahimsa, Satyam. You say only truth, like that. This is a very outer thing. Means it applies to the whole world. That is Sarvabhauma Bhavatam. The whole world, these 5 things, Ahimsa, Satyam, is applicable everywhere. In all the religions, all the places, everywhere. And Niyama, it is Shamjam, Sandosham, like that. Cleaning, other things will apply to more ourselves. Third one is Asana. Asana is completely personal. But outside body, not inside. Most of the things, asana, nowadays yoga is equal with asana. Not that. This is only the third step. Asana, through asana our body will be intact. Then after that we have to go inside, pranayama. Pranayama means breath control. Breath control for that what? Breath control for mind control. Because breath is the reflection of mind. When mind is disturbed, breath will become fast. When mind is calm, breath will be slow. So, just opposite, if you control the breath, you can control the mind. So, that is the 4th step. We have entered a little inside. Then, Pratyaharam. You are very aware of what you take in, all the foods. Not only food from through your mouth, even through your ear, your eyes, all these are controlled. That is pratyahara. Then these are all outer things. Next you enter inside. Dharana, Dhyanam, Samadhi. So like that, this purification starts from outside and slowly, gradually come inside, and the last point, Samadhi. This is not dealt with in Ayurveda. There are Trivarga. Dharma, Artha, Kama. But in yoga, moksha also is discussed. So that is Chaturvana. This is the way, this is the route. This gradual uplifting ourselves, that is the way of yoga.
Okay, sir. Dr. Ravindra is going to talk about the Shat Chakras and Kundalini Shakti. So, do you think any Ayurvedic treatments have a direct impact or effect on Shat Chakras and Kundalini?
I think all the treatments can be connected to that because we are nothing but the chakras and all the concepts related to that. So the therapies which we are doing can be very well connected to the Shat Chakras. Not only Shat Chakras and all the nadis in the body. Nadi means a directed flow of energy is called as nadi. It need not be a confined channel. So it can, wherever there is a direction for the flow of the energy, prana, that itself is called as nadi. So nadis should be understood properly and nadis should be properly controlled or connected while doing the therapies. Even the marmas are also connected with the nadis only. So while doing any therapy, we must be very careful not to damage the marmas as well as how to make the movement of the energy through the nadis. Because the blockage in the nadi, fundamentally the blockage of energy in the nadi is the disease. So for curing the disease, you will have to remove the blockage from the nadi. The character of the blockage that differs. Mainly the ama, due to the weakness of the metabolic fire, that is the cause of all the blockages. So we must consider that that blockage has to be removed while doing the treatments. But all the Shat Chakras are related to the 5 elements. So 5 elements are the body itself. So I think it can be directly connected to that. But as I said earlier, there are certain diseases which are also connected with the chakras, in which we need to give importance to that chakra while treating them with the hands, because all the manual therapies, they are directly done in the body, and through which we are connecting ourselves to the buddhi, the brain, the faculty in the brain, and the brain is doing the healing. Basically, our own buddhi is doing the healing process. We can only stimulate that healing process. So that is the concept of Ayurveda, basically. So I think all the concepts of yoga should be borne in mind while performing the treatments. So that then you will get the most benefit of the treatments. And for our guests who are here, I really want to say one more thing, that the quality of our medicines and the quality of the treatments, that really makes the healing response. So that part is very, very important, whether it is yoga or Ayurveda, it's not very different. For yoga also, we should understand the fundamental principles of it. I used to think that the Ayurveda is the foundation knowledge, and the yoga is the edifice which can be made. Not only yoga and tantra, both are the edifice which can be made over the foundation of Ayurveda. So Ayurveda is fundamental in every practice of Indian origin. So that is the thing. That way they are very closely connected.
Okay, sir. Dr. Hari, actually we were discussing about purification. I think purification is something very unique to both Ayurveda and yoga. And in Ayurveda we have Panchakarma therapies. In yoga we have Kshatriyas. So can you explain the relationship, the connection between these two systems?
The uniqueness of Ayurveda and yoga is a purification process. The conventional system has either internal medicines or surgery. But we have something in between, before surgery, as a purification process. Even after the purification process, if the disease is not cured, that is a stage where surgery is recommended in Ayurveda as a last resort. As the question, Panchakarma in Ayurveda and Yoga Kriyas. So we have very parallel or similar techniques both in Ayurveda and Yoga. For example, Vamana or emesis, where the medicine is infused and all the impurities are taken out by vomiting. In Yoga, we have Vamana Dhauti, a technique where, like salt water, drinking and instantly vomiting. So, a cleansing practice which purifies the body time to time, apart from the person practicing yoga every day, the body is clean. We say a vessel which is rubbed and cleaned every day shines well. But sometimes our body has a tendency to accumulate impurities over the period of time, even though we are practicing daily. So we need an intense clean. Like we clean a house once in a month, a thorough cleaning, something like that. So we have a technique where we can induce vomiting in yoga, which is called Vamanadharati, and in Ayurveda we have Vamana with medicines. Of course, certain conditions we will need intense use of medicines to get more benefits as the deeper cleaning happens. Similarly, we have Nasya, a nasal application of medicine to clean the upper part of the body. In yoga, we have Neti, which is done with water as well as with the threads called Jala Neti or Sutram. And we have a purging technique in Ayurveda which cleans through the down part. The same is applied through drinking water, hot water, and allowing to purge instead of vomiting. It's another way of cleaning. In Yoga Shastra, we have certain technique like Vasti, Enema, where it is an advanced practice where people need to use or insert certain type of bamboo or those days, like pipe-like thing, where the water is sucked in and eliminated. In Ayurveda, we have, like enemas, we have vastis, different types of vastis to purify and strengthen the body. And apart from that, in yoga, we have like dhaudis and nauli, some other techniques were to purify and strengthen the Agni. So we will see parallelly cleaning both through Ayurveda and yoga, trying to attain the same goal, but sometimes Ayurveda wins because the power of medicines and the preparations. But for a daily practice and a cleaning for a yogi, daily asana practice and routine purification process are good enough.
Okay, thank you, Dr. Hari. I think our time is almost over. The last question I would like to ask Dr. Devanandapuri, because our job here is to discuss integration of Ayurveda and Yoga. So can you please give some example from your experience, how you integrated both Ayurveda and Yoga in your clinical practice?
As Dr. Hari told, Sakarmana Shodhanam Cha. There are 6 karmas. Dhauti, Vasti, Tatha, Nedi, Lauligi, Travakam Tatha, Kapala Bhadis Chaidani, Sakarmani. So these Sakarmas can be practiced. So Jalavana Dhauti, Dhauti is of food type. Drinking water, as we told, salt water, hot, salt water, and when it is necessary, especially in this Vasantakalam, now actually the season is going to be changed here. In the Hemantam and Shishiram, Kapha Vruddhi happens, Kapha Dushti happens in the coming Vasantakalam. At that time, we can utilize Vamana Dhauti Kriya. Also, Vastra Dhauti is also the another process with the a long piece of cloth soaked in salt, hot water, that is swallowed and taken out, and that on that we can see the stick phlegm. It's also a cleansing process. So when it is necessary, it is practiced. So the same, it is a practice of cleansing process. Here in Ayurveda also, Pancha Sodhana Kriyas, as we told, every doctor knows that one. Vamana, Virasana, Asthavana, Anuvasana, and either Ragnamoksha or Shirovedana, that is necessary. So the same principle is accepted in yoga, and that is possible. This vastis of two types, Shushka Vasti and Jala Vasti, sitting on the floor, absorbing the air through anus. It is not an easy thing, but it is possible. So we can cleanse our body without medicine in yogic practice. So the principle is the same from the experience itself. I can thoroughly tell that the principle is the same.
I think I will wind up the session with the last question to Dr. Ravindra. Can you explain one simple experience from your clinical practice where you have integrated both Ayurveda and yoga?
Integration of Ayurveda and yoga, it happens in two different ways. One is we used to have yoga groups coming to our place. So 3 weeks we do Ayurvedic therapy for cleansing the whole system, cleansing as well as nourishing the system. And the last 1 week will be exclusively for the yoga. As I said earlier, Ayurveda is the foundation and the yoga is the higher practices. So when we have this 3 weeks of Ayurvedic cleansing and nourishing therapy, and the last 1 week of yoga is really enriching. And this used to be done, we have done this many years with great masters in yoga, different groups. That is one thing. That's a specialized practice. Other than that, on a regular basis, in our massage and other treatments itself, we are using the concepts of the yoga like the Pingala upwards, Pingala, Ida and other major nadis. So in our direct treatment for every person who is coming for treatments, we are utilizing the concept of the Pingala and Ida and Sushumna in the direct massage and other therapies, and it's really functioning very well, and we do have a lot of experiences in that.
Thank you all. Thank you for the nice discussion.
Do we have any questions from the audience? Okay, so that was a very interesting session we had. Thank you all. Let's have a group photo and then the mementos.
Thank you so much for the patient hearing.